Good afternoon. Thank you for joining the webinar. My name is Elizabeth Siegel, and I'm a policy analyst at the Council of State Governments Justice Center. Before turning to the content of the webinar, I'd like to briefly talk through a couple of house cleaning items about how the webinar is going to work, and then take a brief moment to tell you a little bit about the National Reentry Resource Center and the Justice Center's youth program. Anytime during this webinar, you can ask a question by typing it into the QA panel on the bottom right-hand portion of your screen. We'll keep a running list of the content-related questions that we receive, and then ask the panelists to respond to the questions during the last segment of the webinar. We'll do our best to get through as many questions as possible. If you encounter technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we're recording this event and we'll post it on our website. We should have the webinar posted online early next week, and once it has been posted, we'll email you a link to the recording. The Council of State Governments Justice Center is a national nonprofit that serves policymakers at the local, state, and federal levels from all branches of government. We provide practical, nonpartisan advice and consensus-driven strategies informed by available evidence to increase public safety and strengthen communities. The Justice Center's youth program provides state and local policymakers comprehensive research, analysis, and technical assistance that support collaborative and consensus-building strategies that reduce recidivism, improve school discipline practices, and incorporate the appropriate behavioral health interventions for youth and their families. Within the Justice Center's youth program, there are two main areas of focus: the School Discipline Consensus Project and the Juvenile Justice Project. The School Discipline Consensus Project is a national initiative to provide policy recommendations for supporting schools that are addressing the impact of suspension and expulsion on students' academic outcomes and involvement with the juvenile justice system. The Juvenile Justice Project is focused on helping state and local governments to protect public safety and help youth who are involved with the juvenile justice system become law-abiding, productive adults. Be sure to join the National Reentry Resource Center on Wednesday, October 8th, for a webinar hosted by the School Discipline and Juvenile Justice staff on what works to promote educational success for youth in the juvenile justice system. The Second Chance Act, which was signed into law in 2008, is the first federal legislation passed by Congress to authorize federal support for reentry programs. The bill authorized up to $165 million in federal grants to state, local, and tribal government agencies and nonprofit organizations. Recognizing how complex reentry initiatives are and the importance of integrating research and evidence into those initiatives, the Second Chance Act authorized the creation of a National Resource Center for adult and juvenile reentry. In 2009, following a competitive process, the Council of State Governments Justice Center was selected to launch the National Reentry Resource Center and provide training and technical assistance to all Second Chance Act grantees. The National Reentry Resource Center is administered by the Council of State Governments Justice Center in partnership with the Bureau of Justice Assistance, U.S. Department of Justice. Since 2009, nearly 600 Second Chance Act grant awards have been made to government agencies and nonprofit organizations from 49 states for reentry programs serving adults and juveniles. Approximately 20% of these grants have been awarded to agencies and organizations serving a juvenile justice population. The Justice Center is constantly adding new content and resources to our website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events, and other news about reentry. To sign up for our newsletter, please visit csgjusticecenter.org/subscribe. Also, please be sure to visit the website's youth pages at csgjusticecenter.org/youth. The Juvenile Justice Project page provides an overview of CST Justice Center's juvenile justice-specific work. On this page, you can learn about our juvenile justice-related activities and also access seminal publications and resources from the field on juvenile justice topics. The Juvenile Reentry page provides the most current information and resources on what works to improve youth reentry and overall juvenile justice outcomes. Today's webinar will feature Josh Weber, Program Director of Juvenile Justice at the Council State Government's Justice Center. Josh will summarize the key recommendations for improving juvenile justice systems approaches to the measurement, analysis, collection, reporting, and use of recidivism data. We'll then hear how the Indiana Division of Youth Services and Florida Department of Juvenile Justice are currently applying these recommendations in their own practice. Josh Weber directs the Juvenile Justice Program at CST Justice Center, which operates the NRRC. Previously, Josh spent 10 years focused on reforming and building the capacity of programs and systems that serve vulnerable youth in the juvenile justice system, youth development, workforce development, and the child welfare systems. In one of his previous roles, Josh led the development and implementation of the New York City Administration for Children's Services Alternative to Placement and Reentry Programs for juveniles using evidence-based practices. He is co-author of Core Principles for Reducing Recidivism and Improving Other Outcomes for Youth in the Juvenile Justice System, as well as the current document, Measuring and Using Juvenile Recidivism Data to Inform Policy, Practice, and Resource Allocation. Mike Dempsey has served as Executive Director of Indiana Division of Youth Services since May 2009. Mr. Dempsey began his assignment with the Indiana Department of Corrections as Superintendent of the Pendleton Juvenile Correctional Facility in June 2006. Mr. Dempsey has been actively involved with the American Correctional Association as a member and certified auditor. He has also been involved with the Council of Juvenile Correctional Administrators, working with the performance-based standards, which are now being implemented in all IDOC juvenile correctional facilities. Mark Greenwald is the Director of Research for the Florida Department of Juvenile Justice and is a doctoral student in the College of Criminology and Criminal Justice at Florida State University. His research focuses on the evaluation of juvenile justice theory, delinquency, and crime in schools. His research has appeared in the journals of Criminology, Criminology and Public Policy, and Criminal Justice and Behavior. I'll now turn the first portion of the presentation over to Josh Weber. Thanks, Josh.
Thank you, Liz, and thank you to everyone for joining us on this webinar this afternoon. We know that data is not always the most exciting topic, but we believe it's critically important to improving outcomes for youth in the juvenile justice system, and appreciate you being with us today. To start with, we want to set a little bit of the context for how and why recent juvenile justice reforms have made it that much more important that juvenile justice systems and agencies at the state and county level measure their recidivism rates and other youth outcomes. Over the last 15 to 20 years, there have been dramatic changes in juvenile justice systems across the country. Since the mid-90s, the arrest rate for juveniles has declined by over 50% to its lowest level in over 30 years. As a result of this decline, far fewer young people are having cases filed and are coming into the juvenile justice system at all. At the same time, because of the leadership of a number of foundations, such as the MacArthur Foundation and the Annie Casey Foundation, as well as the efforts of a number of state leaders and advocates, the country has seen a significant decline in the number of young people who are committed and confined in local or state juvenile facilities. Over the last 15 years, the confinement rate for youth has declined nationally by almost 50%, with many states having experienced declines of up to 80%. As a result of these efforts, more high-risk youth are being maintained in the community instead of going to correctional facilities, placing more emphasis and importance on the quality and consistency of the services that those youth receive to ensure that they can be successful in the community. As a result of these reforms, the stakes are raised for communities across the country to really ensure that the money that they're investing and the policies and practices that are being used to provide services to these young people in the community are effective, and to make sure that jurisdictions reap the cost savings and other benefits associated with diverting youth from the juvenile justice system. In the process of making these dramatic reforms, however, many systems have given less attention to what impact the reforms have had on recidivism rates and other important youth outcomes. In general, very few systems have been able to experience significant reductions in their recidivism rates, and many jurisdictions struggle to measure recidivism rates in an accurate way. As a result, jurisdictions are increasingly giving attention to a number of key questions about youth in their juvenile justice system. What are their rearrest, reconviction, and reincarceration rates? How do youth who are under system supervision fare not only in terms of reoffending, but also in terms of other academic, employment, and important positive youth outcomes? When youth transition off of system supervision, whether those are youth who were diverted from confinement or youth who are re-entering from a time in confinement back to the community, and they are no longer under system supervision, do they transition successfully to a crime-free and productive adulthood? And importantly, what, if any, system supervision policies and practices and system interventions are working and making a positive difference in these outcomes? The state of Texas provides a really brief case study to highlight the importance of these questions and how some of these dynamics are playing out across states and counties across the country, and the importance of having comprehensive and accurate data to assess youth outcomes in the juvenile justice system. Since 2002, as a result of legislative changes that mandated that youth who commit a misdemeanor offense could not be confined in state custody, Texas has seen a dramatic decline in the number of youth committed to state custody, with new admissions declining from over 3,500 to a low in 2012 of barely over 1,000. At the same time that the number of youth in confinement have declined dramatically, Texas has also invested over $100 million new resources for counties to try to successfully maintain those youth in the community. System investments have almost completely reversed themselves in terms of the amount of resources devoted to youth in confinement and those devoted to youth in the community. The average daily population in Texas state facilities declined from a high of almost 5,000 to a low now of little over 1,000, meaning that those resources are used to provide services to a far greater number and a higher risk level population of youth in the community. These significant resource investments and policy and practice changes raise extremely important questions for policymakers, for state agencies, and for county agencies and service providers around whether the outcomes for youth are improving. This chart shows the 1-, 3-, and 5-year rearrest rates for youth in Texas's juvenile justice system. As you can see, the arrest rates for youth at each of those groups are quite high, raising the question whether the impact of these reform initiatives has not only diverted youth from confinement and saved Texas important resources, but also whether these efforts have had a significant impact on improving outcomes for youth. In order to get a better sense of how states across the country are tracking recidivism and other youth outcomes, the Council of State Governments Justice Center conducted a survey in partnership with Pew Charitable Trust and the Council of Juvenile Correctional Administrators to assess the policies and practices of state juvenile correctional agencies in terms of their data collection practices. The survey was conducted in fall 2013, and we received responses from all 50 states as well as the District of Columbia. The survey primarily focused on to what extent state juvenile correctional agencies were collecting recidivism data and how they were using that data to inform their policies and practices. Based on the survey, we've established 5 key recommendations informed by the results of the survey to guide jurisdictions at all levels on how to better measure recidivism data and use that data to ensure systems, policies, practices, and resource investments are improving positive outcomes. Broadly, the recommendations include ensuring that systems are measuring recidivism for all youth in the juvenile justice system and having a broad definition of that recidivism to ensure that you're capturing the many different ways that youth can have contact with the juvenile justice system. Second, analyzing that recidivism data to account for key youth and system characteristics and variables, most importantly, the risk level of the youth population being served. Third is establishing and maintaining the technological infrastructure as well as the staffing resources necessary to collect, analyze, and report this data. Fourth is to make this recidivism data available to key constituencies that need the data to make informed policy and practice decisions, as well as the general public. And fifth, and perhaps most importantly, ultimately to use this data to actually inform and shape and guide juvenile justice policy practice and resource allocation. It's important to note that the survey was conducted only with state juvenile correctional agencies, and so the findings that I'm about to present and the more detailed recommendations are based upon the practices of those state juvenile correctional agencies, but the recommendations apply to systems and state and county agencies and service providers at all levels. It's also important to note that the survey focused primarily on the collection and use of recidivism data, but recidivism is not the only important youth outcome for systems to track. One of the results of the survey did find is that only 20% of state juvenile correctional agencies track in a long-term way whether youth are achieving positive outcomes, such as education improvements, behavioral health improvements, and improvements to their family functioning. Recidivism is one measure of whether youth are getting re-involved in the juvenile justice system, but these positive youth outcomes also give a sense of whether the juvenile justice system is helping youth to be successful over the long term. So while the rest of this presentation will focus on recidivism, we also want to strongly encourage jurisdictions to capture these positive youth outcomes as well, and many of the recommendations that we will be detailing apply to that tracking. The first key finding of the survey is that most states track recidivism for youth in their custody, but 20%, a significant minority, do not track recidivism at all for the highest risk youth under state custody. For the 39 states that do track recidivism, a number of those states are measuring recidivism in a narrow way. 21 states define and measure recidivism using multiple system events, such as rearrest, readjudication, or reincarceration, but only 18 state agencies use one of those events. In addition, of the 39 states that measure recidivism, the majority, but still a number of states, don't capture key ways that youth can come back to the juvenile justice system. For example, 8 states are unable to track whether youth are arrested into the adult criminal justice system, and therefore their measuring of recidivism does not include recidivism in the adult system. 10 states do not capture technical violations of probation, which, while not a new offense, would result in a young person going back to court and continuing or having more intense and restrictive involvement with the juvenile justice system. Based on these findings, the first key recommendation is for juvenile justice systems and agencies to measure recidivism and do so in a comprehensive way that includes all of the many ways that youth might have contact with the justice system. First, we encourage jurisdictions to track rearrest rates. Rearrest rates can give systems a sense of whether youth are coming back into contact with the police and also help to ascertain whether police presence is greater in one community versus another community. Second, we encourage jurisdictions to look at readjudication rates, which give a sense of whether youth are committing further delinquent acts. Third, it's also important for jurisdictions to capture recommitment and reincarceration rates to know whether youth are being confined who were previously involved in the juvenile justice system, and also to capture the significant costs associated with that reincarceration. While it's not necessary for jurisdictions to define recidivism in these multiple ways, and it may be helpful to have one definition of recidivism that includes only one of these measures, we do think it's important to be able to produce data on all of these measures to get a full sense of what's happening with youth in the system. In addition, it's important that jurisdictions collect data on technical violation or revocation rates. This also gives a sense of how youth are complying with their conditions of probation or parole, whether those conditions are overly restrictive and causing youth to not succeed, and also gives jurisdictions a sense of the performance and practices of their probation and parole agencies, and whether some jurisdictions, more than others, are violating youth and can help support the development of a more consistent and standardized way to approach youth misbehavior. It's also critical that jurisdictions track new offenses processed by the adult criminal justice system. While this can be time-intensive and often require a matching process with the adult correction system, as fewer youth have become involved in the juvenile justice system, many jurisdictions have experienced that their population has become older. And by the time that they're released from a facility or end their time in community supervision, they have entered into the adult correction system. As a result, jurisdictions that don't track recidivism into the adult system might be missing a very significant proportion of the reoffending that is occurring with their juvenile justice system and not getting a true sense of their success. Finally, it's also very important to track new offenses that occur after youth is no longer under system supervision. Research has shown that when youth are still under the oversight of a probation or parole officer, that contact tends to have a suppression effect on their reoffending behavior, which is no longer always apparent once youth transition off of system supervision. So capturing recidivism once a youth has left the system will also give a true sense of what kind of impact interventions are having. Next, the survey looked at to what extent jurisdictions are able to analyze the recidivism available to them, and found that while many state agencies analyze their recidivism data in a number of ways, there are key gaps in the analysis processes. First, and most importantly, only a little over half of all states measure and analyze recidivism by the risk level of the youth population under system supervision. That risk level is a proxy for the likelihood that youth will reoffend. And so it's critically important that jurisdictions are able to compare the likelihood that a youth has reoffended with whether they actually reoffend. Similarly, few states are comprehensively analyzing their recidivism data by other key characteristics, including the offense the youth has committed, the jurisdiction that they're coming from, their needs, how long they have stayed in a facility, and the specific program or intervention that they received. This leads to the next recommendation, which is the importance of analyzing recidivism data by key characteristics. First, and most importantly, we encourage jurisdictions to analyze recidivism by youth risk level, which is critical to actually assessing the performance of the system agencies that oversee youth in the system. For example, a jurisdiction might report a low recidivism rate, but that low recidivism rate may not necessarily mean that the agency is performing at a high level, but instead may mean that the youth under its supervision are low-risk youth who are less likely to offend regardless of the agency's intervention. Similarly, a jurisdiction might experience an increase in their recidivism rate and be criticized for that increase when, in fact, the increase is due to the fact that the system has gotten better about diverting lower-risk youth from the system altogether, and the agency is serving, in general, a higher-risk population that is more likely to offend, and may actually be performing better with that population, even though recidivism rates are increasing. And so in this way, it's critical that agencies can analyze their recidivism data and report it by risk level because it provides essential context to know whether the risk level of the population being served is changing and how that relates to agency performance. Being able to assess recidivism data by risk level requires that jurisdictions are using a validated assessment tool to assess risk, that they're assessing that risk with fidelity and reliability, and also that they're capturing that risk assessment data in an electronic system that lends itself to analysis. We recognize that these are ambitious goals for many jurisdictions, but critically important to having a true sense of whether the system is being effective with its population. Similarly, it's also important that systems have the capacity to analyze recidivism data according to key characteristics of their youth, such as youth demographic groups, youth service needs, as well as the interventions that systems are employing to address those needs, including the facilities in which youth are placed, different service providers, lengths of stay, and facility and community-based intervention. This analysis is fundamental to being able to understand and drill down into which youth are being served better or worse by the system, which policies and practices are effective to meet their needs, and for systems to be able to actually use their recidivism data to guide and improve their policies and practices. In general, across jurisdictions, we see that very few systems invest the resources needed for this kind of analysis, but in order to ensure that this data can actually be used to drive and shape system practices, it's critical. And would also encourage, in instances where resources are not available, to look to partner with universities or other local experts who could support this kind of critical analysis. The third area that the survey looked into was states' capacity to actually collect and report on this recidivism data. While many states reported that they have significant capacity to collect this data, over a quarter of all states rated their data collection capacity as below average or weak. For many systems, it can be extremely challenging to collect any recidivism data, let alone the rearrest, readjudication, reincarceration, and technical violation data that we suggest collecting. Particularly in bifurcated juvenile justice systems where counties and states all control some part of the juvenile justice system, and many different agencies and locales can touch a youth during their journey through the juvenile justice system, it can be very difficult to aggregate and collect this data across different agencies and different case management systems. As a result, our recommendation is to establish a system-wide electronic case management system that captures youth dispositions, their service provision, and their outcomes across their time in the juvenile justice system. This will likely require interagency information sharing agreements across the different agencies involved in the juvenile justice system, and wherever possible, agreements with child welfare, education, and behavioral health systems to attempt to capture this data as well. It will also require the time and resources to establish policies and procedures to guide state and county officials on how to enter data appropriately into these systems, ensure its integrity, and make sure it's being used appropriately and confidentiality laws are being respected. This can require a significant investment in resources and also in staffing that can be difficult for many jurisdictions to fund on their own. But those jurisdictions that have been able to invest in a single system-wide electronic case management system have experienced significant benefits that outweigh the cost. As an example, the Oregon Youth Authority, which is a bifurcated juvenile justice system, was appropriated resources by the state legislature under the agreement that it would work to get all of its counties to agree to participate in the system and help support its youth. They were able to develop a uniform juvenile justice information system that now tracks youth throughout their time in the county or state juvenile justice system, and that they can use to track recidivism rates and other outcomes for youth throughout their time in the system. This data has proved invaluable to them shaping their policies and practices in ways that support improved outcomes. Next, we looked at the extent to which states are sharing and reporting recidivism data with key constituents. While the majority of states share their recidivism data with all branches of government, there are many state agencies that still do not report this data to important constituents, such as the judiciary, other state youth service agencies, and state advisory groups. Even fewer state juvenile justice agencies reported this data to service providers, legal stakeholders, and other key parties within the juvenile justice system. As a result, we recommend at least annual reporting of recidivism data to all branches of government, court personnel, state advisory groups, service providers, the public, and other key system stakeholders. One group that often gets left out of that list is agency staff. Oftentimes, recidivism and other outcome data are only shared with agency leadership and research staff and never make their way down to the management and line staff that have such a critical role to play in improving outcomes for youth and who could benefit from using that data to guide their efforts. So it's important that agencies and systems commit to transparency and sharing this recidivism data at all levels with all groups who need the data to make important system decisions. Similarly, it's not enough to just report this data in an annual report with a list of numbers, but instead to be thoughtful about how to share this data in ways that different stakeholders can understand, easily focus on, that's relevant to their work, and that they can use in an actionable way. Many jurisdictions are developing data dashboards or other similar visual ways of reporting information to share this data with policymakers and state and county leaders, and are also making an effort to break data down at the county level, agency level, and service provider level so that those stakeholders have the specific and relevant data they need to apply it to their system, understand where they're being successful and where they're struggling, and what improvements might be needed. Next, and perhaps most importantly, only a quarter or more of states report using recidivism and other performance measure data as the primary source to guide their policy practice and resource allocation decisions. Ultimately, the collection of recidivism data is important not simply to hold agencies accountable, but to use that data to make sure system policies, practices, and investments are effective as possible. Of the 39 states that collect recidivism data, most use it for system monitoring and to evaluate their progress, but you can see that only half or less use it for much more specific and directed purposes, such as evaluating the performance of specific facilities, specific programs designed to improve outcomes for youth, specific reform initiatives, as well as trying to understand which populations of youth are having a more difficult time within the system, which jurisdictions are struggling to improve outcomes for youth, and the cost-benefit of specific policies and practices designed to improve outcomes for them. We recommend at the system level, the legislative level, and at the agency level, whether you're a juvenile justice agency or a service provider, to establish formal written processes for reviewing recidivism data. Those should at least be annual, but ideally happening even on a more frequent basis to evaluate whether performance is improving overall, as well as to evaluate the impact of specific reform initiatives designed to improve system policies and practices. Those processes could include legislative level reviews, where recidivism data and improvements in outcomes have an impact on budget allocations, and also occur at the agency level to create specific review processes with leadership, with management and line staff, so that all staff are aware of the outcomes of the agency, have a clear and defined role in how they can support those improved outcomes, and are held accountable for policy and practice changes that will improve those outcomes. As part of that process, it's important that agencies and systems set improvement targets and measure recidivism over time. Identifying a baseline recidivism rate, as well as other baseline outcomes, and setting annual targets for improvement that are ambitious but achievable can help systems track whether their interventions are improving over time. A single recidivism rate at a single point in time gives a system very limited information on the success of the policies and practices that it's invested in. Instead, being able to track recidivism over time, particularly if you're able to analyze it by risk level, will give systems a dynamic sense of how the risk level of their population is changing, and as a result, how the performance of the agencies designed to work with those youth are improving in terms of reducing recidivism and other important outcomes. Finally, we also suggest that jurisdictions build regular and formal processes to ensure that recidivism data is promoting accountability and the efficient use of resources. At the system level, this could mean tying overall agency funding as well as funding for specific programs, providers, and reforms to demonstrated recidivism reduction. The ability to analyze and disaggregate recidivism by the various variables we identified, such as facility and service provider and jurisdiction, can allow systems to hold each of these entities accountable and also to identify areas where they need to improve. Similar processes need to take place at the agency level, where staff not only receive and have insight into their outcomes and why their outcomes are improving or not improving, but there are also written improvement plans that identify how those staff will be held accountable and how the agency and system will hold itself accountable for making progress in areas where the agency is struggling. Overall, then, measuring recidivism and other outcomes in a comprehensive and accurate way is not easy, can be resource and time intensive, but is very critical to ensuring that system policies and practices are supporting the best outcomes. And so if there are three key takeaways that we would like webinar attendees to remember out of this portion of the presentation, it would be first the importance of tracking these outcomes. There's a common expression that says what doesn't get measured doesn't get done. And if jurisdictions are not tracking recidivism and other outcomes, they can't actually know and be fully invested in improving system interventions designed to improve outcomes for youth. Second is that a standalone recidivism measure by itself does not mean very much. When you see in an annual report or you see in the news a jurisdiction reporting a 30% recidivism rate, in isolation, that doesn't tell you the information needed to understand whether the system is effective. So the second key takeaway is to make sure that recidivism data is being contextualized and analyzed with important information such as the multiple system events that youth are experiencing, the risk level of the population served, and drilled down into a variety of youth characteristics and variables to really understand what that recidivism rate means and how it applies to youth at different points in the system and the different interventions designed to improve outcomes for those youth. And then the third key takeaway is it's not enough merely to measure recidivism or analyze recidivism or collect this data or even report this data. Ultimately, the value of tracking these outcomes is being able to use this information to improve outcomes for youth in the system, which is the ultimate goal of the juvenile justice system. So ensuring that jurisdictions invest in not just one of these recommendations, but all of them, and think about building their tracking of recidivism in a cohesive and integrated way such that this data is being used to really improve the policies and practices and resources that jurisdictions use to improve outcomes for youth under their system supervision. So with that, I will turn things over to Mike Dempsey, who will talk about how the Indiana Division of Youth Services has employed some of these recommendations in its own system.
Okay, thank you, Josh, and good afternoon to everyone participating today. I'm going to talk about some of the various ways that Indiana has used recidivism data to improve many of the long-term outcomes that we have envisioned for the youth in our care. So first, let me start by saying that Indiana defines recidivism as a return to incarceration within a 3-year period after an offender's release date. And that can be a return to a correctional facility, whether it be adult or juvenile. The graph that you see in front of you is one of the demographic charts that we use. And this one simply breaks down the total number of youth who were released in 2010. And the overall recidivism rate of those releases was 30.5%. 13.4% of those were juvenile facility returns, and 17% were recidivists to an adult correctional facility. This next slide is simply a snapshot of our website, where you can find all of our recidivism data reports. So in addition to releasing the recidivism reports to legislative branch, governor's office, all of our juvenile judges, we also place each of the reports on our website, and those are accessible to virtually anybody who wants to get on the website and take a look at them. We also make the data readily available to all of our staff within the Department of Corrections as well. This slide is just simply shows one of the modules that we use in tracking recidivism by length of stay. And as you can see, we break it down by 3 months, 3 to 6, 6 to 9, 9 to 12, and so on. You'll see that on the right-hand side of that, it shows the overall recidivism rate for each of those demographics. Now, early on, probably 4 or 5 years ago, when we first really started taking a look at our recidivism data, one of the things that we found was that one of our higher recidivism rates was in the 1 to 2 year category. And I think that rate at the time was somewhere around 50% or higher. And what we found when we really looked into those numbers and the kids that were involved in that 1 to 2 year period was that the vast majority of those kids were low and medium risk youth. So it was interesting to discover that as we were looking at it, thinking because most of those kids you would think would have been released prior to that time. So what we found was that the lower and medium risk kids were essentially lingering in the system and lingering there much too long. They were there past any effective length of stay date. So looking at that data, some of the things that we introduced is reform efforts or initiatives to impact that group and that demographic of that length of stay module. Was to look at that length of stay and figure out why those kids were in the systems for so long a period of time. What we found was we didn't even have a legitimate process to establish what the length of stay should be for the kids in our system. So we established what we called a projected program completion date system. So each kid, when they came into the intake facility, they were evaluated based on their risk and their needs, and a clear outline was made as to what programs going to need to be completed and in what time frame that could be done. At the time, kids had no idea when they came into our system how long they were going to be there or what it was going to take for them to get out. So again, they just seemed to linger in the system. So the CPPD or PPCD program helped alleviate that concern. One of the other things that we really worked hard on was building relationships with juvenile courts and the judges and probation staff, making sure that they had accurate information as far as what the recidivism rates looked like and why we were specifically targeting reducing the length of stay for a particular group of kids. In the 3-year period that followed these reforms, the percentage of youth who were incarcerated fell from 39% to 30.5%. So this next graph is a breakdown on the racial demographics. And just to be clear, we certainly don't believe that youth are more likely to recidivate as a result of their race. But what's important is that you can glean a lot of interesting information by looking at this demographic. And I'm going to show you exactly what I mean on the next slide here. One of the things that we looked at early on was the recidivism rate of the Hispanic youth that we have in our population. And 4 or 5 years ago, that rate was one of the highest that we had in our system. And we really delved into that and wanted to figure out what was going on with that in order to make an impact on that group. And what we found was one of the main causes of the recidivism rate was that those youth lacked access to community resources. They didn't know where to go for community resources. So we partnered with the Bienvenido program, which trained volunteers to conduct training and mentoring programs for the Hispanic youth inside our facilities. And it essentially, in the end, it connected those kids with mentors and with the community resources and volunteers to assist them during the reentry and transitional program. As you can see on the previous slide, that recidivism rate for the Hispanic youth has dropped to 18.2%. So over the course of 4 years, that recidivism rate dropped from one of our highest to one of our lowest, just by determining what the issue was with that group of kids. So this slide is one that one of the other initiatives that we focused on was family engagement. And we realized that having families engaged with the kids while they were inside our facilities was extremely important. It could have a wide variety of impact on those kids and their recidivism rates. So this slide is a performance-based standards outcome measure slide, which simply measures the number of treatment plans which included family members in their development. As you can see, that the goal is to have all our facilities at 100%. And this has been a work in progress. The earlier historical data on this chart will show you that early on outcome measures data collection cycles, those numbers were nowhere near 100%. So what we saw was a correlation between the increase in family engagement in the treatment planning process and the reintegration process for the kids, how it related to having the parents and families engaged in the process while the youth were inside our facility. So some of the things that we did in working with the families was to essentially empower them based upon each of their strengths and their active role with the kids while they were inside the facilities. Impacted, what we found was that influence and their involvement inside the facility had a tremendous impact on the youth's behavior while they were inside the facility, and it created a more positive atmosphere, and it also built built trusting relationships between the kids and the staff, but also the parents and the staff as well. We actually develop programs where we actually bring parents inside the facility and we take them on a tour of the facility. They walk around, they talk to staff, they see where their children are going to be staying and living. And one of the things that the parents have said after doing that is how much more comfortable they feel about their child being inside our facilities because they can actually see where their kids are. They talk to the staff and they see how the staff and the kids relate to one another. This is one of the things that just had a tremendous impact on our facility culture and the climate, which I believe also has an impact on the long-term outcomes for those kids because we can make a more significant impact with the kids while they're in the treatment programs, while they're inside the facility. The next thing that we also focused on was how education can impact recidivism rates. And over the course of about a 5-year time period, Indiana conducted a recidivism study, which involved 6,561 offenders. Now, most of these were adult offenders, but there is a correlation between the younger offenders in this study group and how it relates to their education and the correlation between that with their recidivism rate. So what they found was that obviously offenders who had lower education levels were more likely to recidivate. Among 306 of these offenders released with a college education, the recidivism rate was 31%. That rate increased to 46.2% for offenders who were released with only a GED, and it increased again to 55.9% for offenders who were released with a below high school education. Of the entire group released in 2005, the recidivism rate among African American males under the age of 30 with an education below high school was 61.8%. So the results of the study consistently revealed that undereducated offenders, primarily those among the younger offenders, was significantly higher with the lower education levels. Our own PBS, performance-based standards outcome data, also showed the same results. There was a clear correlation between the improving math and reading scores of juveniles in our facilities with lowering the recidivism rate. This slide is showing the demographics in relation to education levels. And as you can see, as the education levels increase, the recidivism rate primarily decreases as well. Now, it's a little deceiving when you look at the GED and high school recidivism rates that they're extremely high on this one particular chart. But if you look at the sample size of those that are involved in those, they're extremely small. So I think it's a bit misleading. But you can clearly see on the right-hand side there how the increase in education primarily does decrease the recidivism rates. This chart is showing, again, it's another one of our performance-based standards outcome measure charts. And this one is showing us how over a period of time, beginning in April 2010 through October of 2013, just having a focus on increasing or improving math and reading scores over a period of time, and the correlation between that and the drop in our recidivism rate. So since those times, the rate has gone from 48% on an average increase in scores to 84% in our juvenile facilities. And I think that shows a clear relationship between improving those scores and reducing the overall recidivism rate of the youth exiting our facilities. One of the other things we took a look at was post-release support, and this chart is showing a breakdown between parole and direct discharges and their recidivism rates in year 1, year 2, and year 3. As you can see, the rates just continually increase the farther out that you go. What I think is interesting about when you look at this chart and you see that the recidivism rate is actually lower for those who are direct discharges, I think what's important to note in that is that direct discharges are primarily made up of our lower and medium risk youth. So those who are on parole are clearly the higher risk youth and our sex offender population as well. So a couple of things that we did in relation to post-release support in order to help improve the outcomes and help reduce recidivism rate as a response to earlier on data. One was to establish a juvenile parole division. For years, Indiana had a parole system that was adult-focused, and all of our juveniles who were released on parole were supervised by adult parole officers. So we broke that out. We developed or established our own juvenile parole division, and they are what we call juvenile reintegration specialists. And those specialists begin meeting with kids and meeting with families. Again, as part of the family engagement piece, they start meeting with kids and families while they're still inside the facilities and begin that transition period. And they continue to work with families and the youth post-release, and with a focus on education, employment, outreach services, counseling, treatment, and any other types of needs that might be developed. This slide is one of the other demographics that we take a look at, just broken out by offense level. And as you look at these, you can primarily see that obviously the higher the offense level, you would think that the higher the recidivism rate as well. And that primarily holds true when you get into the misdemeanor level and status offense level. The recidivism rates are much lower than the felony offenses. And again, I think that this relates back to one of the earlier findings that we had, where we found that some of our lower and medium risk kids were having longer lengths of stay. If you looked at this graph 4 or 5 years ago, those lower numbers for the misdemeanors and the status offenses were actually higher in some cases than the felony offenses. And that primarily was a result of the contamination effect that takes place between mixing those lower risk youth with the higher risk youth. So taking a look at that and some of the initiatives that we undertook as a result of looking at the offense types was to help reduce the contamination effect of the higher risk youth on the lower risk kids. We worked with the courts in our state JDAI initiative to place lower risk youth in alternative community-based programs. The target was to keep lower risk youth out of secure detention with the belief that if those kids weren't being held in secure detention, then the courts would not commit those kids to the deep end of the system and commit them to the DOC facility. So as that related to the Juvenile Detention Alternatives Initiative, we actually started JDAI in one county, Marion County, which is the county Indianapolis is located in. And we have since expanded. Our next step was to expand JDAI out to 8 counties, and we've now started a statewide expansion project, and we are currently up to 19 counties that are involved in the JDAI process. I don't know if you know, but Indiana actually has 92 counties in it. But the current 19 counties that we have involved in actually impacts about 42% of the youth who are involved in the juvenile justice system in Indiana. So we're really targeted the counties and the locations that we involved early on in the JDAI process. And through that process and through the efforts that we undertook, it helped reduce our overall population by about 60%. 5-6 years ago, our population level inside our juvenile correctional facilities was about 1,200 youth, and today we average about 420 on average, and some days that even goes below 400. So the process of targeting the front end on these lower and medium risk kids and making sure that the kids are in the right place for the right reasons, for the right length of time, with access to the right services has had a profound systematic impact on our population level, but also on outcomes for the kids who are involved in the juvenile justice system as a whole. And I believe it's also one of the factors that has helped us reduce our overall recidivism rate.
Great. Thank you so much, Mike. So what we see here is Indiana Division of Youth Services, really impressive efforts to clearly define key youth outcome data of interest, collect that data, really drill deep and understand some of the challenges that data presents, and then, of course, determine next steps to address those challenges and make improvements accordingly, ultimately being able to realize positive youth outcomes as a result. So thank you for sharing, Mike. And we'll now turn the next portion of the presentation over to Mark. Thank you, Mark.
Thank you. And so I'm mindful of the clock, and so I'm going to be paying attention to how much time I spend here. But what I'm going to do today is talk to you a little bit about how Florida uses strong research and data to make decisions, how we use recidivism data, and I'm going to highlight just kind of one of the projects that we work on and how we make data and information available to both our staff and stakeholders in the community. Just some quick facts about the Florida Department of Juvenile Justice. We're a centralized juvenile justice system. That means that we control the entire juvenile justice process, from prevention programs, think Boys and Girls Clubs, things like that. We don't totally fund them, but that's part of our prevention package here in Florida. For prevention programs all the way through the deep end services, residential commitment, and aftercare services, and everything in between. One of the other things that we have that I think is a big benefit is that we have a centralized information system, which is called JJIS. It is a centralized system that records all of the offense information, arrest information, placement, supervision, status, risk assessment. Everything you can think of is crunched right into that centralized information system, which gives us some distinct advantages in that I can calculate quite a few things just by looking at what's in our computer. And then the third thing is that we have a dedicated research team. I'm the director of our research office, and I have a team of analysts. And our job is to constantly evaluate the programs and services that we fund that are available for our kids, and to provide recommendations on what we can do differently and how we can improve the services that we have. We're pretty proud of our website. Over the last couple of years, we've made a pretty strong effort to drive more and more information to the web. And we do that for two purposes. One is so that we can share as much information with stakeholders, local community folks, and whatnot. And the second one is there's a self-interest, a selfish interest. That's so that I don't have to spend as much time on the phone answering questions. I can send people to the web and show them where they can grab data on a variety of things. And this slide here, what it shows you is that we're right on the main part of the department's webpage. We're one of the key links at the top. And we have quite a bit of information that's available on the web, everything from just general delinquency data, what delinquency looks like in your community, how many kids are going through different types of services, et cetera, et cetera. Some quick facts for people that just want some quick facts. out of the information system for grant writing or other things in their community. We have a really deep page that I recommend you to go take a look at. That's called Myth versus Facts. We spend an awful lot of time dealing with myths, and so we went ahead and dedicated a page that it looks at different types of myths versus facts, and then a host and variety of other different reports you can see here. Today, what I'm going to talk to you about is I'm going to talk about the Juvenile Justice System Improvement Project, which is a project we've partnered with Georgetown University to implement that takes the comprehensive strategy and implements it in Florida, and I'm going to explain what that is. The comprehensive strategy, a lot of things in juvenile justice, they're looking at one component of the system. You just heard my colleague from Indiana talk about JDI, for example, which is a great program. We have it here in Florida. And that focuses on the detention continuum, the detention process. The comprehensive strategy deals with the continuum of juvenile justice services. So you're looking at everything from risk assessment to the decisions you make in the courtroom to the type of services that are available to kids and how effective those services are that you have for kids. And one of the core components of the comprehensive strategy is what's called structured decision making. Which doesn't sound like rocket science, but we don't always use structured guidelines in how we make decisions and what we do. It wasn't until the 90s that we in Florida had detention risk assessment instrument, for example, to determine who does and does not get detained at the intake process. It wasn't until the early 2000s that we implemented one of the first comprehensive risk needs assessments for juveniles. And so what the structured decision making process is this is a specific set of guidelines that I'm going to show you in just a second that helps give our staff a recommendation on what do we do with certain types of youth when they present at intake and the recommendations that we make to the court. So if we have a kid that comes in and looks like this, is this kind of history, is this kind of risk, what do you do? Do you go on gut feelings or do you go on a set of standards that are based on some kind of research where we've analyzed the different pathways kids have taken in the past and where we got the best bang for our buck? And that's what we've developed here in Florida, and we're starting to use and develop all across the state. And then the third part that I wanted to kind of go over today was the continuous monitoring, which is where my office comes in. We come in with the development of these research projects and then militant monitoring of how well we're doing. I'm a big believer in what gets measured gets done, and so we try and push as much data and information out to folks as possible so that they can make decisions and look at how well they're adhering to what it is we're looking for them. What we're looking to have them do. So this slide shows you a copy and example of our disposition matrix, and unfortunately today I don't have time to go into a lot of detail, but essentially what it is it's a guide, it's a grid that tells our staff to look at the type of offense the youth has, what their risk level to reoffend is as determined by our risk needs assessment, and what kind of recommendations we should make to the court. And then there's also a third component that takes in the kid's history. And the idea being is that, we want to see kids treated equally. We want to see equity all the way from Key West to Pensacola, all the way across the state. For example, if we have a kid that presents who's a first-time misdemeanor who has been caught with a dime bag of marijuana, do we send that kid to a residential program? The answer should be no. That kid's probably going to be much more effectively served in the diversion program, something like that. So this sets up a series of guidelines for our staff to follow. That being said, they're guidelines. It's not prescriptive. We don't say we're absolutely not allowed to go outside the range of what we're recommending. But it gives staff a set of structured guidelines so that they have some guidance as to what are the best outcomes, how are we going to get the best outcomes from these kids through the specific service that I recommend to the court. And although I don't have time to go into detail with this, we found a lot of very, very interesting things when we were developing this. This was built based on data. We looked at our data in our system, we looked at the pathways kids took, and we found that there's different types and levels of placements, and what we call an optimum placement. That is, if the staff follow the recommendation that we're telling them in this grid they should follow, you're going to get the best recidivism. On average, across the entire continuum, that's everything from prevention to residential, you're going to get a recidivism rate of just under 19% for all those youth, okay? Now, if you go above the guidelines that we recommend, for example, if we go back to that misdemeanor marijuana possession, and let's say, our grid here says to divert that youth into community, some type of diversion program with maybe substance abuse overlay, and you decide you're going to put that kid in maybe a deep end community placement. When you go above our guidelines, you actually double the recidivism rate. The recidivism rate jumped to 34%. But another part of our validation study found that if you go below the guidelines, if you don't give a kid enough of an intervention, it tripled the recidivism rate. It jumped to 54% recidivism. And so it tells us that we need to match the right kid to the right service at the right time. And if you do that, you get the best recidivism outcomes. And we see that repeatedly. We recently validated this. It's on our website, and our website link is on all of these pages. And we're constantly looking to see if there's a better way we can build this mousetrap. But right now, the current version that you see here is the version that's getting us the best bang for our buck. When you go on our website, and again, I'm going to go back here. If you go to our research tab and you click on anywhere in this little box right here, you're going to be taken to a site that's dedicated to this particular project that I'm sharing with you today. And when you go there, you're given an opportunity to look through a number of different pages. And one of the things that we have up there that I wanted to talk about just briefly was definitions. Yeah, I think it's important to always have definitions for everything that you're doing. My colleague from Indiana, he started off by defining what recidivism means to them. And that's important. We define exactly what we mean for recidivism and everything else in the continuum right on our definitions tab. This is just a screenshot of one of those, but we have definitions for everything available on those pages. And then you can move on to other subsequent pages that show, what I call visual adherence to the continuum mapping to the structured decision guidelines. And what this shows is we have 20 judicial circuits in Florida, and the circuits are down here at the bottom. And then we have 4 different kind of placements. You've got kids that go below guidelines, kids that got the optimum placement, meaning that they were put in a placement that our research and data suggests was the most optimum pathway for that kid. You've got kids that got an appropriate placement. That means maybe it was a little bit higher, but it was still in the general range of what we were looking for. And then you have kids that are above guidelines. That would be an example of we recommend a kid for diversion or community placement, and that kid maybe went to a commitment placement, which would be the deepest end of the system here in Florida. And what this shows you during the time, whatever time period you choose, it shows you the adherence of each of our circuits to that model. And we have not rolled this out everywhere in Florida, but one of the places where we started was Circuit 6. And you can see the vast majority of their placements are optimum placements. And we have not seen a corresponding increase in recidivism. It hasn't been kids gone wild. We're not seeing crime increase, crime reported to police. Everything's just fine. But what we've seen is we've seen an increase in the number of kids receiving optimum placements, which by and large are diversion and community-based placements, which has reduced our need for residential services, which again happen to be the most expensive services. And then we have another small chunk of kids that are getting appropriate. It might be a little bit higher, but still within range. And then the ones we keep an eye on are these kids that are below and above guidelines. Again, these are guidelines for staff. They're not meant to be restrictive. There are very good reasons why you might want to go above or below, but it should be the exception and not the rule. And so this just helps us gauge how well folks are sticking to those guidelines that we've laid out for folks. Right now I'm giving you static slides showing you what it looks like kind of in a static way, but what's really neat about the website is you can interact with all of these reports. You can change the disposition stage. You can look at kids and where they went and see how that changes the chart. You can look for risk to reoffend, low, moderate, high risk. You can look at differences between boys, girls. If you're interested in differences in race, gender, race and ethnicities, you can change the chart to see exactly how things change, and the chart will change as you change these cells. Another view that we have are state-level reports, because we have, I thought we had a lot of counties, but Indiana beats us, but we have 67 counties in Florida. And this next report shows you how to compare your jurisdiction, say, to other jurisdictions. Florida has 10 counties that really drive about half of the number of arrests that we receive. Those are our most populous counties here down in South Florida and in Central Florida, and then a couple here in both wings of the Panhandle and top right-hand side of Florida. And this shows you how different jurisdictions, different counties compare to these placement guidelines that we've established. And you can click on your individual county, and if this was live and online, you can click on your county, and you can see information that's specific to your county. And then the software also allows you to print out what you're seeing on the screen very easily, so that you can take it into different meetings or include it in grant applications or whatever else that you happen to be working on. Another report that we have gets down into really, really nitty-gritty details. This is something that we have available for our staff on the website that allows them to look exactly at the number of placements that occurred during whatever the particular study period was, what percentages of the placements ended up going to those, and where they fell on that continuum. And then they use this to constantly staff and evaluate, did we make the right decisions? For example, if I have kids that were above guidelines, it seems here we have a couple of kids that, we had one kid that went to secure where it was above, and 21 kids that went to non-secure commitment, both these are commitment levels. Did we make the right call? Well, could we have done something differently? What were some other pathways we could have chosen for those kids? And staff go through these reports monthly, and they look to see how well we're adhering to the matrix and whether or not there's any changes that we can make. Because again, what I started off saying is we validated this matrix to show that if you follow these guidelines, we get the best recidivism outcomes, which again provides us two primary things. One, increases in public safety. These kids are not creating new victims, they're not going out and recidivating. And then two, by and large, that means you're putting kids in more effective community-based placements, which are less expensive and cost us less money. And so the analytics that we use to drive this stuff, we use a lot of different software in Florida. Everything from Tableau. Tableau is the software we use to generate and put all the stuff on the web. I'm not a salesman for Tableau, but I really like it. It's very easy to use. You don't have to be a PhD to work with that software. It's a great way of putting some data into some charts so that you can present your stuff visually to your customers. We use Excel, of course. SPSS is what we use to analyze all of our data. We use Stata for our higher level statistics. And whenever we're doing statistical modeling, we're using IBM SPSS Modeler. But just to give you a couple other examples of things that we do in Florida is we're constantly analyzing different types of phenomenon in the juvenile justice system here in Florida. And I'm not paid to put out good news. I'm paid to put out whatever it is we find. And so whatever it is we find, we throw it on our website for everybody to take a look at, good or bad. For example, we recently looked at gang activity for kids in our system, what that looks like. We looked at domestic violence, youth charged with domestic violence, and we've come up with some different and better ways, I think, of working with those youth and those families to address, the issues that were causing that domestic violence. We just recently put something on our website about obstruction and resisting arrest and how that, just happens to be a predominantly black male phenomenon, which is probably not dissimilar from the way it is in many other states, but it's something where we're not really calling one out, but we're putting the data out there so people can look at that and ask questions and start to dig a little bit deeper. And then, we've also got things related to general delinquency briefings. What does delinquency and crime look like in Florida? How's it trending? Are we moving up? Are we moving down? Serious violent and chronic offending. That's a really interesting briefing sheet that I encourage you to look at because we want to have a delinquency system that covers a continuum of kids. 2/3 of the kids that are arrested in Florida and come to the Florida Department of Juvenile Justice are not going to come back. So one of the best things we can do is not a whole lot with those kids. And so what we do want to focus our resources on is that other third, and even a much smaller percentage of that third, the serious violent chronic offenders, which happens to be just under 9% of the kids in Florida. Those are the kids that I call the frequent flyers that are constantly generating new offenses and are generating a lot of our workloads or committing some of those serious offenses. And that's where we really need to focus our time, effort, and resources, not on the lightweight kids that probably aren't going to come back to us. I went through this very, very quickly because I know we want to have plenty of time for questions and answers, but I do encourage you to go to our website. This is just one static example of different reports that we have out there, but we literally have dozens of different reports that are out on the web for anybody to review and look at. And you can interact with those. You can download reports from those. And if anybody has any individual questions that you don't get answered today, feel free to email me at the email that you see here. I strongly recommend that you email me and not call. Much more likely to give you a response if you email me. But with that, I'm going to turn it over to the question and answer folks.
Great. Thank you, Josh, Mike, and Mark, for your time. So this final portion of the webinar is going to be devoted towards addressing questions. If you should have a question, if not yet shared it, you can do so now by typing it into the box in the lower right-hand portion of your screen. The first question is directed to Mark. Mark, regarding these online tools, how did you go about encouraging staff, generating buy-in to actually reference and utilize these online reports on a monthly basis? and of course educate them on the importance of this data and how it can be used to drive decision making and make improvements?
Well, some of it is just the fact that they know somebody's looking at it. For example, with our kids in the domestic violence program that I talked about, we constantly look at kids that are eligible for this program that takes kids who otherwise would be put in a detention center. And we have respite beds where they can go to these respite beds instead of secure detention. And they can receive family services that address that underlying domestic violence behavior. And so one of the things my office does is we look at kids who, according to their data, look like they qualify for that service, but didn't go. And so we send that data out to those folks every month and say, hey, this kid looks like they qualified. Why didn't that kid go? And sometimes it's because someone just made a mistake. Sometimes it's because of a very good reason. Maybe they were making threats when they were in their intake process or had shown violence at that respite bed before that they weren't appropriate. But what we saw very quickly is just the fact that they knew that somebody was looking at it, was going to have them explain why they didn't do something. That in and of itself made a difference, and it caused a change in behavior. Rather than doing the easy thing, which is putting a kid in jail, they made the extra effort to connect the kid with those other services that we didn't have to detain those youth. So what gets measured gets done. The other thing can be just, if we as an agency tell staff that something is important, we want you following these guidelines, we want to do these things, we're going to measure how well you're doing with these things. You're going to need to staff and work with us on the cases that go out and above those guidelines. That lets staff know that you're committed to it. It's important. And someone doesn't want to have to explain the same thing multiple times. And so if it's something where we need to change behavior, it happens usually pretty quickly.
Great, thank you, Mark. This next question is directed to Josh. Josh, in your portion of the presentation, you spoke about systems partnering with universities or other bodies to help collect and measure key youth data. Can you elaborate on this further, perhaps provide an example?
Sure. We see a number of systems where they may not have the capacity and resources to hire staff within the agency to do this kind of sophisticated data analysis on their own, but that there's a local university, such as in Utah, partnering with the University of Utah, who has both the expertise and the capacity to support some of this data analysis. And where that's the case, and agencies have been able to develop these kind of partnerships, one of the big advantages is that universities are often seen as a more objective entity, and the recidivism and other analysis data that they produce can be more trusted. They can also contextualize that data with empirical research into other systems and other best practices. And also one of the things that both Mike and Mark talked about is not just the regular collection of recidivism data and tracking of outcomes, but more sophisticated empirical analysis on specific subject areas or comparison evaluations where you compare youth in the juvenile justice system who get different interventions. And those kinds of comparison evaluations really are the most rigorous way to understand what's working and what's not, and something that agencies will rarely have the expertise to be able to do and wouldn't be seen as an objective third party to conduct. And so really developing ongoing relationships with universities for both ongoing analysis as well as episodic, more imperial comparison evaluation can be a really useful tool for systems.
Great. Thank you, Josh. And this question was for Josh, but can also be addressed by Mike and Mark and in your experiences. But when we talk about setting, understanding baseline rates for this key outcome data and setting annual targets for improvement, can you give examples of this? How often should systems be reviewing and setting these targets, and over what period of time?
Mark, did you want to talk a little bit about how Florida does that?
Yeah, we have many targets that we lay out there, and I think one of the most important things I heard earlier say was you want to make targets aggressive but achievable, and the big thing is achievable. Over the years, I'm not going to lie to you and say that we have a incredibly complex and sophisticated empirical process for determining these targets. More recently, it's gotten better, but sometimes it's just a number that somebody makes up. And sometimes that's okay. For example, if you've got a recidivism rate of, right now our recidivism rate for residential programs is 42%, and we want to do better. Do I think we're going to drop that to 32% next year? No, we're not. But we can make incremental improvements. And so sometimes you can use, you can do a trend analysis. You can do a time series analysis, look at how you're kind of trending. Or you can just set a generic target that we want to remove, or we want to reduce things by X amount, or increase kids that go to the service by X amount. And you come up and you look at your data and you look at your services and come up with what you think is a good target to hit. But you don't want to make it so high that you're not going to hit it, because that can discourage, that can discourage your staff, your stakeholders, and everybody else.
Great, thank you, Mark. We have one more question too. This question is directed to Mike. Mike, were you, as part of your work with JDI, were you able to expand services for youth returning to those particular counties? And if so, how did you pay for that, those services?
Sure. We did, the way we set ours up was through our community corrections grant process. So we had some funding that was identified through the state legislature that would be directly tied to the JDAI statewide initiative. And those dollars were put into the DOC's Community Corrections Fund. And then the Division of Youth Services solicited grant applications from the JDAI counties, and they applied for dollars to be put, grant dollars to support both front-end and back-end programs that would be targeted for those kids in those counties.
Great, thank you. So we've hit, the 3:34, and we're over our time, and so I wanted to first thank all the panelists today, Josh, Mike, and Mark, for your time. For participants on the webinar today, if you're interested in more information on this particular topic, I encourage you to read the full report on measuring juvenile recidivism, which can be accessed on the Justice Center's youth page. With that, we will close out. I would like to let folks know that, one of our priorities at the Justice Center is to ensure that juvenile justice systems and different membership groups consider how they can use the recommendations highlighted today to improve their systems approaches to measurement, analysis, collection, reporting, and use of recidivism data. And while the Justice Center has a limited amount of resources to present systems, if there are systems or organizations on the webinar today that are interested in support in an in-depth and tailored way, you should feel free to reach out to Josh Weber, whose contact information is listed on the screen in front of you. So this concludes today's webinar. After you exit the webinar, a brief survey will appear on the screen. By answering the questions in the survey, you'll be helping the Resource Center improve on the services we offer. So we'd greatly appreciate it if you would just take a few minutes to complete that survey. We'll email a link to the recording of this presentation, as well as a link to a PDF of the PowerPoint slides used in the presentation early next week. And these links will also be made available on the National Reentry Resource Center's website. And again, please remember to subscribe to the National Reentry Resource Center's newsletter at csgjusticecenter.org/subscribe. Thanks again for your participation in the webinar, and have a great day.